Recently, I wrote a letter to the editor entitled "Make a Date to Vaccinate. Do it for the people who love you," which was picked up by the Winchester Star. The letter addressed my belief that America is poised to confront a health divide between those who have been vaccinated for COVID-19 and those who have not. The CDC now estimates that the surging COVID-19 Delta variant is 60% more transmissible than its predecessors. Of greater alarm is the reality that 99.5% of new COVID deaths are among those who have failed to get a vaccine. That's right, 99.5% of new COVID-19 deaths are among the unvaccinated. That we've arrived at this point is remarkable. That we still have elected officials broadcasting misinformation and disinformation is the height of public irresponsibility. One of the reasons that I jumped into the House of Delegates' 33rd District race is tied to my utter dismay that my opponent, Dave LaRock, has consistently denied science, supposedly in the name of medical freedom, while simultaneously and repeatedly voting against expanding Medicaid coverage to residents within the 33rd District and the entire Commonwealth of Virginia. Consider the following. In June 2021, LaRock wrote a website post oriented to Virginia State University students on how they could obtain a vaccine exemption on religious grounds, noting that the practice of one's faith is much more of an assertion of personal beliefs versus established doctrine. In other words, go ahead and claim an exemption on religious grounds, even if your reasons are not religious. And by the way, where I come from, we call that a lie. LaRock also asserted that we put the quotation marks on the word vaccination because while that is what most call it, these first 3 shots are actually a chemical mixture. This is exactly the type of sheer foolishness that inhibits our nation's ability to return to pre-pandemic normalcy. But my opponent's denial of science isn't something new. In January 2021, LaRock asserted that the vaccines couldn't be trusted in making an explicit argument against people registering to get a shot. If Dave LaRock was only ignorant about the efficacy of COVID-19 vaccines and the actual science behind them, that might be forgivable. But the fact of the matter is, he has openly argued and repeatedly voted against the health of his own constituents. Consider the simple fact that LaRock voted against Medicaid expansion in Virginia not once, not twice, but a total of 7 times. This despite clear evidence that more than 400,000 low-income Virginians would benefit. Furthermore, an AARP analysis determined that over 4,000 plus residents in Loudoun, Clark, and Frederick counties would benefit from Medicaid expansion. Additionally, a recent Wall Street Journal report highlighted the degree and extent to which Medicaid had proven to be an essential medical access program throughout the pandemic. But if it were up to Dave LaRock, hundreds of thousands of Virginians would have been placed in medical peril for no good reason. I'm once again reminded of the plain reality that good government is grounded in good judgment. Yet again, it's obvious that on health-related matters, my opponent is not only uninformed, but actively pushes misinformation that puts constituents in harm's way. So what are we to conclude? Well, how about this undeniable truth? Dave LaRock is bad for your health. Just consider his votes and his crazy commentary regarding COVID-19 vaccines. It's ridiculous, and in a pandemic, it's dangerous. If elected, I pledge that I'll promote greater access to health care for all Virginians, not because it's the convenient or politically correct thing to do, but because it's the right thing to do. This November's election is more than voting for an individual or party affiliation. On November 2nd, our values are on the ballot. If accessible and affordable health care is important to you and your value system, the choice is clear. It's time for new leadership grounded in good judgment that cares about your well-being, rather than a fringe political framework that puts your health as an afterthought. I look forward to earning your vote this November, and I promise I will not let you down. Authorized and paid for by Siker for Delegate.